go up to Omaha, Loretta Carroll. Loretta.
Thanks, Wendell. Mr. President, Tuesday in North Carolina, we talked about the cost of health care reform for service industries, specifically restaurants. Here with me now is Herman Cain, the CEO of Godfather's Pizza. He has some concerns about that.
Thank you very much, Mr. President. Thank you very much for this opportunity. And I would first like to commend you on making health care a national priority. In your State of the Union speech, you indicated that 9 out of 10 Americans currently have health care insurance primarily through their employers. And tonight you indicated that out of those people who do not have insurance, 8 out of 10 of them work for someone. And your plan would force employers to pay this insurance for those people that they currently do not cover. I would contend that employers who do not cover employees do not for one simple reason, and it relates to cost. Now, I have gone through the rigors of calculating the impact of your plan on my business, which has about 525 units throughout the country, and we employ in total over 10,000 employees. I have also talked with hundreds of other business people, and they've also calculated the cost impact on their businesses. I believe that this is something that we should and can fix, but for many, many businesses like mine, the cost of your plan is simply a cost that will cause us to eliminate jobs. In going through my own calculations, the number of jobs that we would have to eliminate to try and absorb this cost is a lot greater than I ever anticipated. Your averages about the impact on smaller businesses, those are all well intended, but all of the averages represent a wide spectrum in terms of the businesses impacted. On behalf of all of those business owners that are in a situation similar to mine, my question is quite simply, if I'm forced to do this, what will I tell those people whose jobs I will have to eliminate?
Well, let's talk a minute about what you would have to do. Are any of your employees insured now?
Yes, sir. Approximately 1/3 of my employees are insured now.
And of the third that are insured now, what % of payroll is their insurance cost?
My insurance costs at the present time run approximately 2.5% of payroll.
And what do you provide them with? They share the cost 50-50 or something like that?
Cost 75% paid for by my company and 25% paid for by the employee. Now, 2/3 of my employees are part-time or short-term workers that fall into the class that you identified earlier.
Okay. Then if they're part-time or short-term workers, they wouldn't add all that much left. You wouldn't have to pay the whole 7.9% for them because they don't work all the time. And let me ask you this. On average, food service businesses, payroll is about 1/3 of the total cost of doing business. Is that about what it is?
That's an adequate estimation. Yes, sir.
Okay. So suppose, since you have part-time workers and some wouldn't have to cover it, so you wouldn't go from 2.5% of payroll to 7.9%. You might go to something like 6%. If you had 6% of payroll, let's just say instead of 2.5%, or let's say 6.5%, that's a good even number. You had 4% of payroll, and that's 1/3 of your total cost. So you would add about 1.5% to the total cost of doing business. Would that really cause you to lay a lot of people off if all your competitors had to do it too? Only if people stopped eating out. If all your competitors had to do it, and you ask 1.5%, and your cost of doing business went up 1.5%, wouldn't that leave you in the same position you are now? Why wouldn't they all be in the same position? And why wouldn't you all be able to raise the price of pizza 2%? I'm a satisfied customer. I'd keep buying from you.
If I may, Mr. President.
No, I'm serious. This is a very important. Let me say, this is a very important question because a huge number of Americans are involved in the food industry. 40% of the American food dollar is spent eating out now. 40%. So this is not an idle question. This man is raising a very important question in terms of employment. But what if all your competitors were just like you? Wouldn't you be able to do it then?
Okay, first of all, Mr. President, with all due respect, your calculation on what the impact would do, quite honestly, is incorrect. Let's take, for example, the fact that after I went through my calculations, your calculation or your example of the 6% or the 7.9, And in my case, it works out to 7.9%. Now, let's suppose that 30% of my costs are labor costs. 7.9 times that would be the 2 to 2.5% that you're referring to. The problem with that calculation, sir, is the fact that most of those 30% of the people currently have zero. So when I calculate in the fact that I have to go from no coverage on those employees to full coverage at the 7.9% rate, it actually works out to be approximately 16%. Now, your other point about having to pass it on to my customers, in the competitive marketplace, it simply doesn't work that way, because the larger competitors have more staying power before they go bankrupt than a smaller competitor. They have more staff that they could simply do without until the marketplace re-establish itself. So what I'm saying and suggesting is that the assumptions about the impact on a business like mine are simply not correct, because we are very labor intensive. We have a large number of part-time and short-term employees that we do not cover for one simple reason: we can't afford it. My bottom line net profit for the last 2 years was less than 1.5% of my top line sales. When we calculate the cost just for my company under your plan, it equates to 3 times what my bottom line profitability is.
Okay.
Now, so what is one of the biggest misconceptions, sir, is the fact that a company like mine only makes between 1 and 3% of top line sales. And because we have a large population of employees that we would like to cover, but simply the dynamics of our business will not allow us to do that under your proposed plan.
Let me ask you a favor. Would you send to me personally your calculations? Because I know we got to go on to other questions, but